Hi, I'm Dr. Randy Martin with Northwestern Medicine's Bloom Cardiovascular Institute. We're here at the CAST AF meeting, which is a fabulous meeting that's been going on now for 2 days. And at this meeting, we're really learning about new therapies, both catheter and surgical therapies for atrial fibrillation, which is a giant health problem. And I'm pleased to be joined by not only an illustrious faculty, part of the illustrious faculty, but the 3 co-directors of this program. Dr. Brad Knight. Brad is not only professor of medicine, but the medical director of the Center for Heart Rhythm Disorders. Dr. Jim Cox, who is known to many of you, and Jim is professor of cardiac surgery and also the surgical director of the Center for Heart Rhythm Disorder. And Dr. Pat McCarthy, who's professor of medicine and the executive director of the Bloom Cardiovascular Institute. So let me ask you guys, this has been a fabulous meeting. I think as Jim was just talking, it's a mixing of surgeons and electrophysiologists. How'd you guys come up with the concept for this meeting?
Well, it was time. Way back when, Jim and I used to go to the Heart Rhythm Society, and we would invite electrophysiologists to our cardiac surgery meetings, and then the two worlds sort of diverged, but it's coming back together. There's more procedures that are hybrid involving surgery and electrophysiology. We actually have a common language. There's technologies that we use together, and so we said, let's create this unique meeting that has not been done before on ablation using both techniques.
And you know, you at Northwestern, you obviously have that. You have the cardiac surgeon and the electrophysiologist. Jim, you were speaking earlier how this has been really exciting to have both professionals that deal with this in the same room and giving talks, learning from each other.
It really has, Randy. It's ironic that if you go back 25 years ago, let's say, it was very common for, picking up on what Patrick said, very common for electrophysiologists and cardiac surgeons to work together all the time, in the operating room,
right,
everywhere. But along about the late 90s, early 2000s, we seemed to go our separate ways. And for the last more or less 20 years, there's been very little interaction, although there's been dynamic development in both areas. So the real purpose of this meeting was to bring the two back together, the two specialties. And I'd have to say, on the basis of what's happened in the last 2 days, is that one major goal is we've been very successful in accomplishing that. It's been the best meeting I've been to in a long time. They always say the best way you can tell if you've given a good party is if you enjoyed the party, and I've enjoyed it.
That's good. Yeah. Brad, so I think Jim is exactly right. You know, sitting in the audience and watching the two disciplines, and a lot of nurses who deal with this and others, what's been exciting for you that you've learned or witnessed during this course?
You know, the AFib meetings I think needed something fresh, and you know, I want to thank Pat and Jim for coming up with this idea to have these two groups of people together. Over the last couple of days, when I go to a meeting for a lot of AF meetings, I've seen a lot of these slides before. I've heard a lot of these speakers. At this meeting, I'd go hear presentations. I had all new information, seeing all new speakers. So it was a really fresh, new type of meeting this time.
That's great. You know, I had a chance to sit in and listen to you guys, and also had a chance to talk to David Haynes about electroporation, which is something I really didn't know much about. And that was an interesting topic, I'm sure, that caught a lot of people's attention.
Yeah.
Did you think that?
Yeah, absolutely. I think electroporation is going to be, or the pulse field ablation is going to be one of the great new technologies that's coming up. It's still early. It's just starting in patients, but the early results are looking incredible. Not very much collateral damage, if any, and then also in the studies at this point, they're showing 100% isolation of the tissue. So that's really remarkable for just starting out.
And it's always interesting to see these new technologies. This is the first new technology that's come out in a long time.
Right.
But we all remember microwave and laser and HIFU, which were, at this point in their progress, similarly praised. So I think it's going to have to go ways to show that it really is an adequate and improved energy source, and hopefully it will be.
No, that's good. So this has been you know, you're all to be congratulated for pulling off a really unique meeting, I think, and a really informative meeting, especially for a simple echocardiographer. I learned a lot. I hadn't thought about slow refractory waves since high school or something like that. But so are you going to do this again? That's the real question. I think you should. I'll give my vote for yes.
We will vote with you. So the other big surprise was attendance. We had no idea how many people that were going to show up. I would say that we have about twice as many people show up as we had thought we would for the first meeting, and I think that word will spread, and all the attendees and the faculty really enjoy it. We have 60 faculty at this meeting, and so we are from all over the world represented with the people that are here.
Well, so you're excited about doing this again.
We had a great group, so I want to thank all the speakers and all the attendees. There were fabulous presentations, and I think over the last 2 days we had a lot of important questions talked about.
Absolutely, and so again, offer my congratulations to you. Great
Thank you.
meeting. And I hope that you've enjoyed this, and I want you to stay tuned. We're going to have a lot more topics from this meeting on atrial fibrillation. It's going to be something that you don't want to miss.